My name is Jahrad Haq. I'm a consultant maxillofacial surgeon based in London. I'd like to present this case to you, which is an orthognathic case, patient with a class 3 deformity and an 8mm reverse overjet. As you can see from the anterior, three-quarter and lateral views, the patient is demonstrating mid-face hypoplasia as well as mandibular prognathism. I always like to take a video of my patients in animation, as well as talking and smiling. In terms of analysis, we can see this patient has a class 3 skeletal pattern, which is made up of mid-face hypoplasia, mandibular prognathism, and he has an incisal reverse overjet of 8mm. He has increased vertical face height, and it's quite nice. He has good tooth show at rest, and also smiling. There's a small incisor midline discrepancy to the left, and he also has some obvious nasal deformity with the nasal tip over to the left-hand side as well. The surgical plan is for a bimaxillary osteotomy plus or minus genioplasty. In order to address the mid-face hypoplasia, I have planned for a maxillary advancement of 5mm, a mandibular setback of around 5mm as well, back to class 1 plus or minus genioplasty. In order to address the increased vertical face height and good tooth show at rest and smiling, I have built in a maxillary impaction of 3mm all around. This should aim to maintain the tooth show given the advancement of the maxilla. I'm also building in a yaw correction to the left-hand side of 1.5mm. I use virtual surgical planning for cases such as these. We can see the maxillary advancement there in blue and the mandibular setback. He has a small horizontal microgenia, so a sliding advancement genioplasty will address this, as well as further shortening the lower anterior face height. Soft tissue predictions, as you can see, before and after, giving some idea of how things are going to look after the surgery. Patient then goes to the operating room, and I will look forward to joining you for part 2 to demonstrate the initial stages of surgery for the Le Fort osteotomy, followed by the bilateral sagittal split osteotomy and genioplasty.